Hi, I'm Dr. Foo Kian Fong. I am a medical oncologist at the Parkway Cancer Center. Thank you for finding the time to attend my talk on head and neck cancers. I will be covering the following topics on mainly understanding the head and neck cancers, nasopharyngeal cancers, and other head and neck cancers. I will share with you the non-surgical management and the latest treatment called immunotherapy and prevention of these cancers. Okay, to understand the head and neck cancers, I first mentioned that head and neck cancers are uncommon. However, they do cause a significant amount of mortality and morbidity in terms of cosmetic and functional changes to the patients. Hence, for head and neck cancers, surgeons, medical and radiation oncologists work very closely together with dietitians, speech therapists as a team for the best outcome for our patients. Most of these head and neck cancers are related to viruses such as Epstein-Barr virus or EBV virus for nasopharyngeal cancer, HPV or human papilloma viruses for oral cancers, and also lifestyle changes such as smoking and excessive drinking. This slide shows the anatomy, the diagram of the head and neck in men. As you can see, the mouth and the oral cavity leads to the pharynx. The nasal passage leads to the pharynx, which is divided into the nasopharynx, oropharynx, and hypopharynx. The airway then leads to the larynx or voice box, then the windpipe, which is also known as the trachea. Food from the pharynx lead to the esophagus or the gullet. In oncological terms, the nasopharyngeal cancer is distinct from the others in that the cancer is usually undifferentiated and it is sensitive to chemotherapy, whereas all other sites are usually squamous cell carcinoma. First, I will share about nasopharyngeal cancer, and I will share on the incidence rates, risk factors, symptoms, diagnosis, staging tests, and treatment. This picture is to show that the areas in dark blue are the areas where nasopharyngeal cancer is endemic, namely in China, Southeast Asia, and Africa. Incidence in Singapore men has been dropping since 1968 when it was the fourth most common cancer to be on the 10th position in 2017. Between 2013 to 2017, there were about 1,450 cases, averaging 292 cases per year. It's more common in men with the ratio of 3.2:1. The peak incidence is between 50 to 59 years of age. Besides Epstein-Barr virus infection, taking salted and preserved food high in nitrosamines may contribute as risk factor for cancer. There are also genetic factors. Those with a family history of nasopharyngeal cancer has a higher risk of 4 to 10-fold. What are the symptoms of nasopharyngeal cancer? Mainly nose block, excessive mucus production, nose bleeding, hearing difficulties, pain in the ears, tinnitus or buzzing noise in the ears, neck swellings, and cranial nerve effects, usually in the late stages. How do we diagnose nasopharyngeal cancer? Diagnosis is usually made by inserting a flexible nasal endoscopy, where we put a small scope to the nose to check and see if there are suspicious areas, as shown in the diagram, and do a biopsy to confirm. We also perform CT scans to evaluate the extent of the local disease and whether it has spread. So once confirmed and after performing a PET scan or CT scan, we can then stage the disease. Broadly speaking, we can divide the stages as early, number one, where cancer is small and not involving surrounding structures with no spread to the surrounding lymph nodes or other organs. Intermediate stage, where the cancer is bigger and has lymph node involvement. Advanced stage, where the cancer affects surrounding organs and has spread to distant organs. Treatment for different stages of nasopharyngeal cancer. The mainstay of treatment is actually radiotherapy in the early and intermediate stage. For the early stage, radiotherapy alone. For intermediate stage, the treatment is radiation with chemotherapy. Surgery is rarely needed in the management of early stage nasopharyngeal cancer. For late stage, where the cancer has spread, the mainstay of treatment is chemotherapy. Increasingly, there is data for immunotherapy. Move to early stage. Radiation therapy is a type of cancer treatment which uses beams of intense energy to kill cancer cells by destroying the DNA or the genetic material that controls growth and division of cancer cells. Radiation therapy uses X-ray, but protons or other types of energy can be used. This picture on the left shows the mask which we will fashion and put on patients to stabilize the patient for radiotherapy. I will be talking about IMRT, or intensity modulated radiation therapy. This is a form of external radiation using many beams coming from different directions in the machine so that the radiation dose is varied and can be sculptured precisely following the shape of the tumor. The benefit is the high dose is confined to the tumor more precisely and the surrounding area receives less radiation. The common side effects of IMRT include skin changes, taste changes, dry mouth, tooth caries, limited mouth opening. The picture on the bottom shows that the bulk of the radiation is on the tumor and less on surrounding tissues. I'll talk briefly about proton beam therapy. This is a form of radiation therapy. However, it uses protons instead of X-ray or photons to treat cancer. Protons can deliver treatment in a more targeted way compared to X-rays. It is painlessly delivered treatment from outside of the body. Proton therapy reduces toxicities compared to the current treatment by reducing unwanted radiation to the surrounding organs. I will talk about intermediate stage nasopharynx. The mainstay of treatment is radiation with chemotherapy. As you can see from the cartoon, these are results of randomized trials comparing radiation therapy versus combined chemoradiotherapy. The combination is clearly superior to radiotherapy, giving an 80% 3-year survival compared with 50 to 65% 3-year survival with radiotherapy alone. I'll talk about an example, Mr. W. This is a 44-year-old Chinese man who presented with the lump in the neck for 3 months. He was found to have locally advanced nasopharyngeal cancer, and he underwent chemoradiotherapy with excellent response, and he has remained well. Next, I will move on to advanced nasopharyngeal cancer. The mainstay is chemotherapy, and the active agents of nasopharyngeal cancer are listed, and we generally use this drug called gemcitabine with cisplatin. It is a chemosensitive disease, and the response rate is between 50 to 80%. The median survival is between 12 to 22 months. There are very few long-term survivors. Immunotherapy with chemotherapy was recently shown to be better than chemotherapy alone. Okay, I will talk about a patient of ours, a 64-year-old female patient who received chemotherapy and radiotherapy in 2018 for an intermediate stage nasopharyngeal cancer. Unfortunately, she relapsed in 2020. She was given palliative chemotherapy for the relapse, followed by next dissection in 2020. In January 2021, she has local, regional, and systemic relapse, presenting with epistaxis. And she was enrolled on the immunotherapy trial in the National Cancer Center. This shows the treatment response in the nose, January and in March. And this shows the response in the lung. You can see that the tumor has responded very well. These are the current 5-year survival for nasopharyngeal cancer for the various stages. As you can see, the disease in the early stage, the survival is much better. I will talk about prevention now. We advise you to take plenty of fruits and vegetables, avoid excessive amounts of salted and preserved foods such as salted fish, and avoid active and passive smoking. I will move on to talk about the other head and neck cancers. Head and neck cancers of the squamous cell carcinoma is an aggressive, life-threatening disease associated with high mortality rates. Although they occur in various parts of the head and neck, they show the same type of cancer cells called the squamous cell carcinoma. There are many causes, and these are related to, for example, the oropharynx, the HPV virus, in the oral cavity taking bitter nuts and smoking, in the larynx, smoking and alcohol, in the tongue, mainly smoking. What are the symptoms of these head and neck cancers? They can present with an ulcer in the mouth or gums which do not heal. There may be swelling or unusual patches in the tongue or mouth. There might be progressive difficulty and pain on swallowing. There might be chronic progressive hoarseness of voice, as well as neck swellings. These pictures show common symptoms of head and neck cancer, including the tongue, the hard palate, the oropharynx, and the tonsil cancer. I will now talk about treatment goals in the head and neck squamous cell carcinoma. For early head and neck cancers, as shown on the left side of this slide, the main modality of treatment is either surgery or radiotherapy. For intermediate stages, the treatment includes surgery, radiotherapy, with chemotherapy depending on the intention of treatment. For advanced cases, the treatment is chemotherapy and immunotherapy. The 5-year survival is 77 to 91% for early cancers, 25 to 61% for intermediate stages, and less than 4% in advanced stages. Locally advanced head and neck cancers. What are our considerations when deciding on the treatment plans for head and neck cancers? We assess whether there are survival benefits and also how much morbidity there are with each form of treatment, be it surgery or radiotherapy or chemoradiotherapy. The preservation of organ function is also important in our treatment decisions, namely on the speech, swallowing, any effect on the airway, and prevention of aspiration of food and gastric material. For example, patients with voice box cancers will need a permanent tracheostomy, which is a pipe to the windpipe affecting their speech if they go for surgery. For those who refuse tracheostomy, another option is chemotherapy with radiotherapy. I will share with you about this patient of mine, Mr. K, who comes from a Middle Eastern country. He's a chronic smoker and presented in 2016 with a 1-year history of a hard palate ulcer, which is growing in size. It was confirmed a locally advanced hard palate cancer. Surgery could not be done as it will cause regurgitation of food. So we recommended chemotherapy and radiotherapy, and he responded well. And now he's 5 years out and he remains well. Treatment of advanced head and neck cancer. The mainstay of treatment is chemotherapy, targeted therapy, and immunotherapy. Currently, the first line of treatment is immunotherapy with or without chemotherapy. I will talk about immunotherapy. What is immunotherapy? Immunotherapy is also called a biologic therapy. It's a type of cancer treatment that boosts the body's natural defenses to fight the cancer. It uses substances made by the body or in the lab to improve or restore immune system function. We will talk about our immune system. The picture on the left shows the main organs in our body related to the immune system. They help us against infection, viruses, and bacteria. This is tightly regulated, as if the immune system is weak, we will get infections easily. However, if the immune system is overactive, we get autoimmune diseases such as SLE, where our body secretes antibodies against our own organs. This shows how our immune system works against cancer. As you can see, cancer cells often secrete chemicals called antigens that is picked up by a special white cell called the dendritic cell. The dendritic cell then goes to the lymph nodes and inform the T cells of these unwanted cells and activate native T cells. The activated T cells will zoom towards the cancer cells and will attack and destroy the cancer cells. However, cancer cells are also very smart. As you can see in this slide, the cancer cells have some antenna on the surface of their cell called a PD-L1 receptor, which tell the T cells that we are friends. Please don't attack me. So currently, we have drugs targeting the receptors, which make the T cells recognize the cancer cells as enemy and attack the cancer cells. I will share shortly about this Mr. A. Mr. A has both nasopharyngeal cancer as well as head and neck cancer. In 2009, he received radiation and chemotherapy for a stage 3 nasopharyngeal cancer. He went to complete remission. However, in February of 2019, he developed a second cancer in the tongue and he underwent operation. In July of 2019, he developed local recurrence and he was given chemotherapy as well as immunotherapy. As you can see in October of 2019, the PET scan showed a very good response and he was maintained on immunotherapy until now. Okay, I will talk about prevention. The first and most important thing is to avoid excessive alcohol and to stop smoking. So the WHO actually recommends that the woman should drink no more than 1 unit a day and men should drink no more than 2 units a day. So what is 1 unit? Well, a pint of beer is 3 units, a glass of red wine is 2 units, and a double shot of spirits is 3 units. So other things in the prevention will be to consider HPV vaccination for your children younger than 24 years of age, see a dentist regularly to check your teeth and to smooth out broken teeth or rough edges, and use sunblock on the lips and stay away from the sun. I will come to my concluding slide. Prevention is better than cure. Avoid smoking and drink in moderation. Make sure your children get the human papillomavirus vaccination. Seek medical attention early if you have any signs and symptoms related to head and neck cancers. There are a lot of advances in cancer treatment today, and hence we can improve long-term survival for what seem a deadly cancer such as head and neck cancers. Thank you very much for joining me in this talk, and I will be glad to answer any question of yours.